Clinical examination in a newborn baby includes a general physical examination and systemic examination. In this video, we will be discussing about general physical examination of a newborn or a neonate. A neonate is a baby who is up to 28th day of life. After 28th day of life, he will be called as an infant. So we are discussing about neonatal clinical examination. So the very first step in neonatal clinical examination is washing hands. So before starting your examination, you should wash your hands either with soap or sanitize your hands with a sanitizer. You should choose a place with a room temperature for examination of the child, and you have to remove all clothing of the newborn for examination. And the very first thing is to take anthropometric measurements. Anthropometric measurements includes weight, length, and head circumference of the child, and you have to plot these anthropometric measurements on charts, on growth charts. This growth chart will give you idea about their centiles and about their ranges. So weight of the child is either he may be normal birth weight, or he may be low birth weight, or he may be extremely low birth weight. Length, we can't measure the height of the baby, so we have to measure length of the child. Head circumference tells us about the size of the head. Either the baby is microcephalic or the baby is macrocephalic. Macrocephalic means having a smaller head than the standard head size for a newborn, and macrocephaly is having a larger head than the standard measured size of a head for a newborn. The next step after anthropometric measurements is a general inspection of the newborn. It includes color of the newborn, activity of the newborn, posture of the newborn, and any gross congenital anomaly in a newborn. Color is important as it is a sign of a circulatory system. If the baby is pink, it means that his circulatory system is functioning normally, and if the baby is blue or he don't have the normal pinkish color, you may suspect any circulatory disorder in the baby. Activity should be normal in a baby. He should not be lethargic or drowsy, and if he is lethargic or drowsy, you may suspect dehydration in a patient, or you may suspect any CNS pathology. Posture should be the baby should be in a normal posture, and you have to appreciate any gross congenital anomaly on general inspection. After having general inspection of the newborn, you have to take a rapid visual assessment of gestational age. Either the baby looks small for gestational age, or the baby looks large for gestational age. After a visual assessment, then you have to take the vitals. Vitals are the most important part of general physical examination of a newborn. In vitals, you have to take respiratory rate of the child, you have to take heart rate, you have to take a temperature and a blood pressure. Respiratory rate in a newborn child is normally between 40 to 60 breaths per minute. If the child is taking breaths more than 60, he will be labeled as tachypneic, and you have to look for the respiratory effort. If the baby is having tachypnea, or having if the baby is if the baby is having if the baby is taking breaths greater than 60 breaths per minute with increased effort of breathing, then there is the baby is in respiratory distress. So you have to provide supplemental oxygen for the baby, and you have to follow respiratory distress protocol for the baby. The second vital is heart rate. Heart rate is normally between 120 to 160 in a child. If it is above 160, then you label it as tachycardia, and if it is below 120, it is labeled as bradycardia in a child. And normally the heart rate is either it is greater than 160 in congenital anomalies like tetralogy of Fallot, ventricular septal defect, or atrial septal defect, or transposition of the blood vessels. So In congenital heart diseases, there will be tachycardia.
The next vital is temperature. The baby should have a normal body temperature, and you have to check the body temperature, especially in preterm babies, as they are susceptible for hypothermia. So you have to maintain a normal temperature in preterm babies.
After noting temperature, the next vital is blood pressure. It is not that much important in a newborn child, but it is important to rule out any congenital anomaly like coarctation of aorta. In coarctation of aorta, the blood pressure in all four limbs of the body is unequal. Normally, blood pressure in right and left limb and upper and lower limb is quite similar or quite equal. But in coarctation of aorta, there will be difference in blood pressure between right and left arm or between upper and lower limbs. Then after taking vitals, you have to look the skin of the child, and on skin examination you have to look for jaundice, for pallor, for cynosis, bruises, for rashes, and any birthmark or hemangiomas etc. Jaundice is very important in a newborn child, as 50% of the newborn suffer from physiological jaundice and they recovered after 2 to 3 days. Physiological jaundice is not a malignant type of jaundice. It is a benign condition and it will recover after 2 to 3 days. It appears after 24 hours of birth. But if jaundice appear before 24 hours of the birth, it is pathological and you have to manage it properly. And pallor on the skin indicates anemia or any blood disorder in a patient. Cynosis may indicate a congenital heart defect, or it may indicate a respiratory pathology. Then you have to look for any bruises as they may present on the body in a difficult labor or in any assisted SVD, or rashes on the body or any birthmark or hemangiomas on the body.